It's a wonderful life. You're expecting twins, but then comes the terrible news. They suffer from twin-to-twin transfusion syndrome, and the prognosis is grim. But then in steps Dr. Julian De Lia. Some of his patients think he walks on water, so stay with us to find out why and learn about his pioneering technique. Dr. Julian De Lia is the medical director of the International Institute for the Treatment of Twin-to-Twin Transfusion Syndrome. This syndrome is a condition of the placenta that strikes about 10% of all identical twin pregnancies. In the U.S., it affects more than 4,500 pregnancies each year. Prior to Dr. De Lia's pioneering work, the diagnosis of twin-to-twin transfusion syndrome was grave for twin babies. Doctor, give me the specifics about twin-to-twin transfusion syndrome and what its risks are.
It's a very obscure problem because it's something that affects the placenta or afterbirth, which we typically throw away after the birth of the baby or babies. A good example, or at least one way to understand the condition, is to compare it to conjoined twins or Siamese twins. For every conjoined twin, in other words, a twin or set of twins that are joined in the body, there are probably 200 sets of identical twins that are joined in the placenta that are in trouble because those blood vessels that connect the twin circulations allows blood to go from one twin to the other, and they develop this condition known as twin-to-twin transfusion syndrome. Once that transfusion begins, one of the fetuses, because of its decrease in blood volume, produces very little amniotic fluid. Meanwhile, the other one, who is the recipient of blood from that donor fetus, produces an excess amount of urine, which is the source of amniotic fluid. And as a consequence, the uterus starts to enlarge at a very rapid rate.
So, when you first started in this, there was really no hope for those babies.
Correct. Most of the reports that existed, or published reports, even up to 1988, I would say, the survival rate was maybe less than 5%, and of the survivors, more than half of them had cerebral palsy. Dr. De Lia began investigating twin-to-twin transfusion syndrome in 1983. After 5 years of work, he discovered a way to use existing orthopedic surgical technology to fix the problem. In 1988, Dr. De Lia pioneered fetoscopic placental laser surgery to treat it. And we insert a 3.5 millimeter fetoscope into the uterus. So I don't know if you know how small that is, but it was one of the requirements of this kind of fetal therapy, that you not make too large a hole in the uterus, otherwise the pregnancy may be lost just from that hole. So we insert the fetoscope with a laser fiber in the, attached to it, identify the connections between the twins, shoot those connections with the laser, remove the fetoscope, and the operation is essentially over.
Now, once you've performed this task, you see basically immediate results, do you not? I mean, the problem's solved, and then from there on out, there's this equalization.
From that moment on, there's the new reality for the twins. You're going to see a much greater chance of survival and a much decreased probability that the twins will be born with cerebral palsy.
So what is the percentage of success with this procedure?
The success is defined as being able to disconnect the twins. As far as the survival of the twins, there are other variables that will dictate whether or not both fetuses survive, or all three fetuses survive in certain circumstances. And I would say that there is overall roughly 80% of all fetuses will survive. When we return, we'll meet Julie and Bach Stockings and hear how Dr. De Lia was able to save the lives of their twin baby boys.
Thank you for inviting us into your home. Each week we feature real people who deal with real-life issues head-on. Some of their experiences are uplifting, while others will break your heart. But in the end, the message is clear. Those who follow biblical principles on the issues of life are blessed. Become a partner with us in providing a positive, life-affirming message to help change the way the next generation values innocent human life. Please consider a generous gift to help offset the costs of producing this important quality programming. You can donate on our secure website at facinglife.tv or by calling the phone number on your screen during normal business hours. Together, we can make a real difference for life.
Julie and Bach Stocking were already the parents of 3 children when they found out they were expecting 2 more. Excited and ready to start preparations for the new babies, the Stockings decided to find out the sex of their new twins. But when they went in for the eventful ultrasound, the news they received was anything but exciting.
We went in and they told us that we had twin-to-twin transfusion syndrome, and it sounded very serious, and it sounded like they were under the assumption that the babies probably were not going to make it.
Unfortunately, the only hope he gave us was related to a study that they felt that we could be qualified for, given the severity of the situation.
And the severity of your particular situation was what?
Well, in order to qualify for the study, you had to have 2 centimeters or less of fluid on the smaller baby. Our baby had 0. So it was really severe. The first thing that they said to us was, no one would fault you for terminating this pregnancy. That was their opener.
That's how they started the conversation?
That was the opener. No one would fault you for terminating this pregnancy. At which point I realized they think these kids aren't going to make it. They think these kids don't have a chance. They think that these kids don't have a prayer in coming out, quote unquote, typical or normal.
Did you never seriously consider abortion as an option?
Never. Never. We didn't know exactly what the right thing was to do, because they were telling us that if the smaller baby were to pass, which they were telling us that he was pretty much on death's door, was the way they were framing it, that the change in blood pressure, because the shared blood between the babies kind of connects their blood pressures as well. If one were to pass, that drop in blood pressure from the ones passing might very likely kill the other one. So we were then put in a position to really grapple with what is the right thing to do, because we want to protect both of our babies, but if they're telling us that this one is going to pass and that his passing will kill your other child, we then felt this sense of, do we have a moral obligation to protect this child that they're telling us they think is okay? So there was a procedure that was offered to us called, I'm not sure what, basically what it means is they would tie off the umbilical cord of the one that appeared to be ready to pass to prevent, the other one from dying. But in a sense then, you're killing one of your babies to save the other baby. And those were some bad days, trying to decide what the right thing to do was. Not what we wanted to do. It was, what is the right thing to do?
Julie's doctors pressured the couple to participate in an experimental study where she would be randomly assigned to one of 2 groups. Julie and Box didn't feel their doctors were being honest about the study and were just trying to persuade them for the sake of the study's success. After feeling unnecessary pressure from their doctors, Julie and Box decided not to participate in the research. Soon after, they received Dr. De Lia's name from a friend who previously had twin-to-twin transfusion syndrome. The level of care they received from Dr. De Lia was completely different compared to previous doctors.
Dr. De Lia is a pioneer, and he does things very uniquely. He's a doctor. He cares about you. He cares about you as a patient. When we drove up to see him on a Sunday morning in a snowstorm, he came out of the hospital. He greeted us at our car and helped us into the hospital, made all the arrangements, and within 2 days we were back in Milwaukee, and Julie was under his care as a patient. We felt that comfortable with him right away.
I felt from the moment I talked to him that he was being honest with me. The doctor that had said, oh, I think you should do the study, I got the sense that he didn't have my baby's best interest at heart. And I always felt that Dr. De Lia did.
When we talked to Julian Box, they had an interesting accusation toward you, and that was that you put the patient above everything else, and that you're truly a caring and compassionate physician. Tell me a little bit about your philosophy and how you practice medicine.
My father always put his patients first. I mean, the phone was ringing all night long. The people would show up at the front door looking for help and so on, and it was the way you live your life. And I think all physicians should live their life that way. Again, getting back to these patients, that they're very vulnerable, number one, and there's a lot riding on this whole process. I mean, two or three babies' entire lives.
In a moment, we'll hear about the Stockings' decision to go through with the laser surgery.
Whether you're a student needing answers, a parent needing help, or a concerned citizen wanting to make a difference, Life Issues Institute has the resources you need to put your values into action. Life Issues Institute is an international educational organization committed to protecting innocent human life. Life Issues Institute knows what it takes. That's why millions throughout the world turn here for help. Life Issues Institute has authored more pro-life publications than any other entity in the world, and its materials are printed in over 30 languages. Radio broadcasts, newsletters, and a website filled to the brim with the answers you're looking for are just a click away. Go to facinglife.tv and click on the link to Life Issues Institute to find out more about how you can change the heart of a nation.
After meeting with Dr. De Lia and seeing the compassion and care with which he treats his patients, Julian Box Stocking knew they were in good hands. 24 weeks into the pregnancy, they decided to go forward with the laser surgery.
He said we were a severe case, and especially with me, I had what was called an anterior placenta. And in order to do this type of laser surgery on an anterior placenta, you have to cut the mom open and take the babies out, so that Dr. De Lia is able to get to the blood vessels from the right angle.
Which are in the back of the womb.
Right.
And you can't go through my back to do that. So they had to do about close to a foot-long incision on me.
He physically removed them from the womb.
He took the uterus out. He took the whole uterus out of my body.
Oh, okay.
And another doctor, can't remember his name, held them. And they,
For 45 minutes.
for 45 minutes, and they pour saline solution over the uterus so that the whole thing doesn't dry out. And he was able to then use the laser beam on the end of the long needle to seal the blood vessels that they were sharing, which solved the problem.
So the solution was immediate as far as...
Right after the surgery.
Yes, the situation resolved itself within, I want to say, minutes, where the blood was flowing to each baby on a more equal basis, and amniotic fluid started to build
For Will.
with Will. And
But at that point, things were corrected, but you didn't know if they'd live or not?
Right. He said the surgery went well.
we didn't know if she'd live.
That was kind of scary because there have been women who've lost their lives having this surgery. And I'm the mom of 3 and a wife, but that's when you have to have faith.
The surgery was successful in fixing the problem, but they weren't out of the woods yet. There was still a chance the babies wouldn't survive the days following the procedure. Will, the smaller of the twins, was so sick Dr. De Lia wasn't sure if it would be enough to save him. A few days after the surgery, Box and Julie held their breath, as Dr. De Lia administered an ultrasound to check the heartbeats of their babies.
He said to me, outside of earshot of Julie, I don't know how this is going to go. He didn't know whether or not we'd have 2 heartbeats or even, and so I want to prepare you that, it could not have gone as well, or one of them might not be with us right now.
So he started on the side where John was, the bigger baby, and we didn't ever have too much concern about John because all of the doctors the whole time had been telling us that he was strong. And sure enough, there was the heartbeat, and then he paused and he looked at us, and this is Dr. De Lia was doing this with us, and he paused and he said, "Now you know," and we said, "Yeah, we know," but he meant this guy might not still be with us. And he moved the paddle across my stomach, and we saw that little heartbeat, and he said, "Well, what do you know?"
What did it feel like at that moment when you saw that little heartbeat pulsing on that monitor?
That was fantastic. It was good.
Nothing tops that, eh?
Yeah. You remember that moment every time you see the boys.
Julie remained on bed rest for 10 more weeks before she was finally able to deliver Will and John, 2 healthy baby boys. Dr. De Lia has seen many successful outcomes, like the Stockings, due to his pioneering surgery. However, his colleagues in the medical profession have been slow to accept his work, initially thinking the surgery would be impossible. But now that he's seen dramatic results, more hospitals and doctors are coming around. But Dr. De Lia has never let this criticism stop him from providing the best of care to these babies and their mothers. Your success in this field and pioneering this technique really has turned around your peers who were critics, haven't they?
Oh, there's no question about that. It seems as though just about every major city with a major medical center is anxious to do this operation. And at the same time, I've gone to meetings, international meetings, where they discuss the surgery, and they're wondering why they have all these complications. I am happy that it's gained wide acceptance. I am sad that I have yet to have anyone ask me to teach them everything I learned in the course of my learning curve, so that they can avoid the same learning curve I've been through.
You've got to take a feeling of satisfaction professionally and personally in that you're affecting so many lives in such a positive way.
Oh, there's no question about it. Again, it goes back to my attitude about everything. I mean, again, the parents for having the courage, and now the docs who have become believers and don't talk so much about terminating the pregnancy and discuss the options for therapy.
What would you say your favorite part of your practice has been?
Well, the fact is that I come into contact with people, I would imagine at least 48 states, and as I said earlier, about 55 countries. I have come into contact with people who know me and are grateful that I was able to help them in one way or another. The favorite part certainly is the successful outcome of anyone's pregnancy. It's great work. It's very good work.
Coming up, Julie and Box express their gratitude to Dr. De Lia for saving the lives of their baby boys.
Look around you. Every day, heroes abound in our country. We're surrounded by people who courageously face difficult obstacles life has thrown in their paths. Tune in each week to meet people who show there are positive, godly solutions to tough, critical situations. We'll tackle challenging life issues such as abortion, stem cell research, adoption, and abstinence. experience and show that every human life is valuable and precious. Join us for inspiring stories of people facing life head on.
Will and John Stocking are now 5 years old. They're the best of friends and enjoy having adventures and spending time with their older brothers and sister. They bring so much joy and laughter to the family, Julie and Box can't imagine what life would be like without them.
I'm so happy that we have them. Sometimes we start to take it for granted. You know, you get busy and life is going on, but doing this reminds us that we almost didn't have them. And they're really funny and they make us laugh. Our family would be very different without them, and we're very much better with them.
They're the core of our family. I mean, not to diminish everyone's role in our family, but we really pivot off of them. And as much as we have other things going on, all the kids, their older siblings are very helpful with them and love them, unconditionally.
And I think that because they were very aware of the fact that they almost didn't get these little brothers, that from the get-go, they've always just loved them.
Here's an opportunity I want to give you both.